Okay, this video is about how to prevent kidney stones. I'm also going to include 2 book reports on books about how to prevent kidney stones. So we'll go through all that. First of all, let's just go through the anatomy. The orange things here are the kidneys. The kidneys are connected by the yellow thing here, the ureter, transports urine down to the urinary bladder. It's kind of like the udder of a cow. When the ureter muscle contracts, it squirts urine into the urinary bladder. That movement of urine from the ureter into the urinary bladder is called the ureteral jet. And that's important because you can check that. You can see that on ultrasound. You can sometimes even see it on CT. This is the urinary bladder, and then this is the urethra. Okay, here's a picture labeled in more detail. And so this again is the kidney, the renal pelvis where it's larger. Then here's the ureter. This is actually called the UPJ, ureter pelvic junction, where the urinary bladder is called the vesicle. So the junction of the ureter and the bladder is called the UVJ, ureterovesical junction. That's the ureteral orifice. Okay, and then the reason that matters is that's a common spot for stones to become lodged. You always look real carefully right here because you'll often see a stone right there. You can get enlargement of lymph nodes in the back of the abdomen. It's called the retroperitoneum, meaning behind the peritoneal space. And retroperitoneal lymph nodes, you'll get those sometimes with prostate cancer, testicular cancer, lymphoma, for example. You can have a bladder cancer that'll obstruct this ureter, but a distal ureteral stone is a very common thing. This is also a common location, and I'm going to show you an ultrasound in a moment of a ureteral stone lodged right here at the ureter pelvic junction, UPJ. Okay, the top of the renal collecting system is called the calyx. The little tip is called the fornix. This little tube that connects the calyx to the pelvis is called the infundibulum. Okay, so we don't need to go into all that anatomy, but just so you've heard it once, because if you read about it or think about it more, those terms are all going to come up. Here's a typical kidney ultrasound. This is normal. So normally when you look at the center of the kidney, the renal hilum, it's just going to be fat. And it's going to be hyperechoic. That means bright, a little bit whitish, if you will, on ultrasound. The renal cortex means periphery or bark, like the bark of a tree. That's going to be hypoechoic or dark. This patient has a fatty liver because the liver should be the same as the renal cortex, but in this case it is more hyperechoic, so it's abnormal. Okay, there's a fatty liver. I see fatty liver all the time. Whenever a patient has a kidney stone, they almost always have a fatty liver. Okay, here is a kidney stone under color Doppler. You can see what's called a twinkle artifact. So that's important because a lot of times I'll see hyperechoic things in a kidney, but I can't say that that's really a stone because look at the fat. The fat's hyperechoic. What's unique about the stone is it'll have a twinkle artifact and it'll also have a shadow. Now I'll show you a shadow on this next one here. Oh, so by the way, another important point is that this kidney stone does not have hydronephrosis. The renal pelvis is not dilated. Okay, but on the next one, there is hydronephrosis. Hydronephrosis means that this stone right here, you can tell it's a stone because you can see the obstructing shadow. See how there's a line of hypoechoic shadow behind this hyperechoic stone? The stone is hyperechoic because the sound beam bounces off of it, but it then has a shadow because now there's no sound to reflect from distal to it. Okay, the renal pelvis is dilated, so that's hydronephrosis. So the way I would describe this is I would measure the stone, looks to me like about 1.5 centimeter. So I would say there is a right kidney renal pelvis 1.5 centimeter stone causing obstructive hydronephrosis. Okay, the relevance of the obstructive hydronephrosis means that it's obstructed, so then you've got stasis. The urine cannot pass into the ureter. Whenever you have stasis, there's a tendency for it to become infected if it stays that way for a long amount of time. So an old saying in medicine is piss and pus must come out. And the danger for the patient is if they have a prolonged amount of obstruction here without this being resolved, this urine can become infected. And infection of the kidney is called pyelonephritis. Okay, so in the relevance, like if you're doing procedures on kidneys, means you got to come in and see the patient that night. You can't just let it go and say, I'll see him on Monday. Okay, here's a fatty liver. You know it's a fatty liver because the density of the liver is a CAT scan, is less than that of a spleen. And again, fatty liver is strongly associated with obstructive kidney stones. kidney stones in general. Here's fructose. Fructose again goes to the liver primarily, unlike glucose goes throughout the body to the brain, everywhere else, and the muscles. Fructose metabolism breakdown in the liver leads to the production of increased uric acid. So somebody who drinks lots of high fructose corn syrup and soda pop and processed food will have increased uric acid in their blood, which is bad. Uric acid makes the blood thicker, predisposing to increased risk of clot. It also then is excreted by the kidneys, and it makes the kidneys more likely to form kidney stones. So you don't want to have high uric acid. Here's a CAT scan coronal image, meaning the patient is facing us. Here's the right kidney, because you always imagine that their feet were facing towards you as if you just walked into the room and they were sitting on the CAT scan table. Here's the left side. There's a kidney stone. Again, about 1.5 centimeters lodged in the UPJ, ureteropelvic junction, causing hydronephrosis, dilated calyces. Look at these calyces, how dilated they are in comparison with on the opposite side. Okay, and then so that's the hydronephrosis because they're dilated. Okay, you can see that patient also has fatty liver with the liver less dense than the spleen. Okay, here's the first book we're going to talk about. The author's name is Evan Goldfisher. The name of the book is Even a Urologist Gets Kidney Stones, a guide to kidney stone treatment and prevention. So this guy is a urologist, and he had kidney stones himself. Okay, so this would be a UPJ stone, ureteropelvic junction stone. This would be a ureteral stone, and they should have drawn one down here. There would be a distal ureter, UVJ stone. Okay, so what's good about the book? The author had stones himself, so he really understands it from a patient point of view, and he puts that into his book. A lot of nice color pictures. So this is a good baby book. This is a good introductory book. Even if the patient is stupid, they could understand this book. So this would be a good one, I think, to be routinely given to patients. The author himself looks a little fat. He doesn't really know hardly anything about urine. At one point, he recommended Crystal Light lemonade, which I think probably has aspartame or something. I'm not sure about that, but I think I recall that it did. I wouldn't be too thrilled with that idea. I wouldn't recommend that. Anyways, risk factors. If you have acidic urine, and you get more acidic urine when you got a lot of uric acid, when you're eating animal protein, that puts a big acid load on the kidneys because it causes a metabolic acidosis, in part because of the degradation of the sulfur-containing amino acids like methionine and cysteine, which are more common in the meat than the animal protein. Animal protein has a different amino acid composition than does plant protein. Okay, and on the opposite hand, fruits and veggies do something good. They typically will raise urine pH. Animal foods will typically lower urine pH, make it more acidic, more prone to forming stones. High SUA, serum uric acid, is characteristic of a high animal protein diet, and it can also occur in a patient with diabetes, cancer, chemo, kidney failure, excessive dietary sodium. Those are all increased risk factors for kidney stones. The patient's sedentary, especially if they're paraplegic or quadriplegic, they get more stones. If they had bariatric surgery, increased stone risk. And there's rare diseases like hyperoxaluria, cystinuria that have increased risk of stone. More common causes of stones include patient being quite dehydrated. Typically, like I said, they're eating excessive animal food, so they'll have a fatty liver. Okay, excessive dietary sodium is a risk factor for stone formation. Fatty liver metabolic syndrome, typical fat, pre-diabetic, diabetic, hypertensive patient. Drinking excessive amounts of iced tea, that was sort of a characteristic patient in the South. So it's not just having 1 cup of iced tea, but some people really drink large amounts of it, especially if they live, like say in the southern United States where it's hot. Excessive drinking soda pop with all that fructose increases the risk. High fructose corn syrup increases the risk of kidney stones. Excessive dietary oxalates. Oxalates are tricky because there's a lot of good foods that have significant amount of oxalates. So that one gets tricky. And most of the patients, again, who I see with stones, they got a fatty liver. So if you're just avoiding fatty liver, you're going a long way towards avoiding kidney stones. Your gout patients, they got high serum uric acid. Some diuretics will increase the risk of stones. Corticosteroids can, excessive chronic stress, excessive caffeine, primary hyperparathyroidism. It's uncommon. Same with these other uncommon diseases: renal tubular acidosis, cystinuria, hyperoxaluria, large sudden weight loss. Vitamin C and D supplements. I wouldn't take either one. Vitamin C supplements can increase the risk. D supplements will increase calcium absorption from the gut, for example. The author says Atkins diet has increased incidence of kidney stone. It's on page 83. he mentions a bunch of high oxalate foods, but a lot of the high oxalate foods are also good foods, so you have to be careful how you look at that. And it depends what your risk is. Recommendations. He recommends the 8x8 rule for drinking water. 8 cups of water per day, each cup 8 ounces. 8-ounce cups of water per day, or let's say glasses. 8-ounce glasses of water per day. To eat a low-fat diet and to minimize animal protein intake. So again, this was a pretty good book. Lots of color pictures and stuff. It's very easy to get through quickly. So again, that would be for a lot of your common stupid patients. If you get a more intelligent patient, this book is better in the sense that it has some weaknesses. What I don't like about this book is it doesn't have any color pictures. There's not as many pictures. But the author goes into more detail. He's sort of much more detailed explanations. And he had some big statements. Right in the beginning, he says 75% of his patients will never have a repeat stone if he gets a chance to talk to them. He calls this the stone clinic effect. He says once you teach a patient why they need to drink more water and avoid animal protein, he says, they just do better. They understand it, and they're more likely to long-term follow the recommendations. Prevention is the cure, okay? The key to success is finding an acceptable way to the patient that the diet could be changed. Some people, for example, don't want to drink more water because they have a job where it's awkward or embarrassing to go to the bathroom. Normal urine pH is 5 to 8. So if the urine is below that pH of 5, then you have a significantly increased risk of stone formation. Animal protein will lead to more acidic urine. And he says dehydration is a common cause of kidney stone formation. Most important advice in the book, according to the author, is to drink more water, especially if you're sweating a lot, in a hot climate, or if you're exercising. Let's see. You can also get dehydration due to diarrhea, sometimes diuretics, water pills. The more waste the kidney must filter, the less water volume it has to flush, and the less water volume it has to flush the waste, the higher the risk of stones. So he does strongly say that. He never says what type of water, and I'm a little cautious about drinking water because, 8 glasses of 8-ounce water, is it the same thing for an 80-pound woman and a 350-pound football player? I don't think so. Also, I'd be careful what type of water you drink. If you're drinking, tap water, then you're drinking more F- fluoride. You're drinking more, aluminum. You don't want to do that. So you would want reverse osmosis water. But if you're drinking reverse osmosis water, it's real hypoosmolar. So I couldn't drink that much and not get a headache. So you have to eat something too. So you still really have to be careful about what you eat. Kidney has 2 main jobs: to filter toxic chemicals out of the blood, to keep the body in balance for water. Otherwise, we'd become water and fluid overloaded. Same thing with your ions. Like the more sodium you eat, the more you're going to piss out your potassium. We're made to conserve sodium and to excrete potassium and magnesium because they're more widely available to our ancestors in plant foods. But the modern diets can have an excess of sodium and a deficiency of potassium and magnesium, so that's bad. And bottom line, you don't want to be eating all that extra sodium. Okay, blood pH. To get your ion pumps to work, you have to have reasonably good ion gradients. Excuse me. Okay, to prevent stones, don't take vitamin D or C supplements. I put the page numbers here in case anybody wants to look those things up. Animal protein contains a large amount of purines, which are precursors of uric acid. So you can see how it would be a bad meal to be eaten like, let's say, a frozen pizza that's got a lot of sausage and cheese. So there's all your animal protein. And it's got a lot of high fructose corn syrup, leading to more uric acid and fatty liver. They said meat also causes leaching of calcium from bones. That's because of the low-grade acidosis. Sodium chloride can also cause a little bit of a metabolic acidosis, with the chloride displacing the bicarbonate from the blood. Kidneys' ability to excrete uric acid decreases with age. Oh, this is interesting. So as you get older, you're less able to excrete uric acid from the body. Therefore, you're less able to handle animal protein in particular. Protein in general, but animal protein in particular. All meat increases the risk of kidney stones. Methionine leads to more calcium in the urine. The reason why I find that a little bit amusing is there's some people going around saying that old people need to eat more protein. I haven't seen a reliable paper that confirms that, and it doesn't make sense to me because I see all these old people all the time. most of them have partial kidney failure. Okay, they got decreased kidney function. So if they got decreased kidney function, do you really want to be putting an extra acid load on them? That doesn't make sense to me. Okay, and you're going to be less able to excrete uric acid with age, so it doesn't make a lot of sense to me. McDougall and Pritikin both said, it's impossible to be too low in protein on any naturally chosen diet. Breast milk's only 5% protein, and we need less the rest of our lives than that. Good luck getting your total protein below 5%. Okay, sweet potato is about 4.5%. It's the best of the starches. So I would say, bottom line, eating more protein is a bad idea, especially animal protein. Let's see. Spinach was especially bad for increasing urine oxalates. Other foods that were recommended to be avoided in somebody who's a stone foreigner is iced tea, strong tea, caffeine, hot cocoa, tomatoes in excess, rhubarb, alcohol. Alcohol limits the ability of the kidneys to excrete uric acid. Ketosis is especially bad for stone formers. It makes the urine pH more acidic all the time, and there's a page number. Atkins and ketogenic diets lead to increased acid excretion into the urine. So they increase stone risk, acidic urine, and increase serum uric acid, and increase uric acid in urine and lowers urinary citrate. Most Westerners eat far too much protein. Avoid dehydration and increase fluid consumption is what's recommended, especially water should be drank. The fatter you are, the more waste products you are making for your kidneys to excrete. If you make a mistake, try to dilute the mistake, meaning if you eat some high-risk fat foods while you're out at a restaurant or something, try to make sure you drink extra water to counteract that meal, okay? And so I think that's all I got on the stone formation. I just had a little bit more, some stuff I had from other lecture. You eat more fruits, you alkalinize the urine, that's nice. Exercise maintains your bone mass. Let's see, anything interesting here? No, not really. Got one more thing here. I'm going to do my little poem. So we remember we do the ultrasound, and we're trying to check if the urine excreted from the kidney gets into the ureter. So we're looking for these ureteral jets. That's a big deal because it tells you the ureter is open and therefore unlikely to have a stone or unlikely to be blocked by a tumor. Okay. And then I was sitting around bored one day, and I just wrote this poem. I had read a bunch of English literature or poetry or something, and I just combined a bunch of things into a poem. So here it is. I call it Ode to a Grecian Tintern Urinal. It sort of came from the idea of, Tintern Abbey, the poem by William Wordsworth, and Ode on a Grecian Urn by Keats. So here it is. 5 years have passed, and 5 summers with the length of 5 long Doppler scans. And again I hear these waters rolling from their mountain kidneys with a soft inland murmur. Break, break, break on that cold gray prostate OP, and I would that I could utter the thoughts that arise in me. And what about the post-void? To void or not to void? That is the question. Whether 'tis nobler in the mind to face the squirms and groans of outrageous BPH or to get a terp. Water, water nowhere, and the phallus did shrink. Water, water nowhere, not even a plink. O peristaltic wave, wherefore art thou? These are the times that try men's bladders. More gel, let's take another look. But soft, what light on yonder color Doppler window breaks? O trumpets of prophecy, if ureteral jets are here, can spring be far behind? What's this? The sonographer's gel has activated the wrong pipes. A happy ending all the same. Okay, so anyways, real quick where these come from. So this is, Notes on Tintern Abbey from William Wordsworth. Break, break, break on thy cold gray stones. That's, from Tennyson when his friend died. And what about the post-void? To void or not to void, of course, that's Hamlet. To be or not to be. Water, water nowhere, and the phallus did shrink. That's from Rime of the Ancient Mariner by Samuel Taylor Coleridge. These are the times that try men's bladder. That's from Thomas Paine, of course. But soft with light on yonder collar Doppler window breaks. That's Romeo and Juliet. O trumpets of prophecy, if ureteral jets are here, can spring be far behind. That's Percy Bysshe Shelley, I think from Ode to the West Wind. And then a happy ending. I learned that one from watching movies. I think one of those Vietnam movies, okay, about the soldiers' extracurricular activities. So, Oh yeah, there's the poems right there. It was Common Sense by Thomas Paine. So anyways, I hope you enjoyed that. I hope that was helpful to you.